It's Lola, and today we're going to talk about the pelvic floor and everything men need to know about what this pelvic floor goes through during pregnancy. Well, maybe not everything, but a lot of it. So not everything we talk about today happens to every woman, but these are things that can happen. First off, what is the pelvic floor? The pelvic floor is this mass of muscles. If you look down into the pelvic cavity here, you can see it forms a sling or basin or hammock-like structure down here. It runs from your tailbone to your pubic bone and then across to each sit bone. Men have a pelvic floor as well as women. Functions of the pelvic floor are to support the different organs that are in this cavity. There are sexual functions of the pelvic floor, and it helps maintain normal pooping and peeing, what we need to do with that. So there's a pretty busy group of muscles. There's a lot of changes this pelvic floor goes through in pregnancy. A lot of this occurs because of all the weight that acts down on this pelvic floor over the 8 or 9 months of pregnancy. Sometimes you can have up to 30 pounds of pressure or more acting down in this area. So, and that's from things like the baby itself, the placenta, the uterus is a little bit heavier, and there's a lot of extra fluids in there too. So that amount of pressure over time really stretches these muscles out. And with this muscle stretching, as the muscles get stretched out, you get weakness. And sometimes that weakness can lead to things like leaking urine or leaking poop, either one. We call that urinary incontinence or fecal incontinence. You can also get things like prolapse, where the organs themselves, the bladder, the uterus, and all moves further down in here than it should be from the pressure of it. So then you go through labor, okay? Or the woman goes through labor. Of course, you go through it with her probably. And during the labor, what happens is there's even more trauma to this area. So these muscles get stretched and they can get torn. And when they get torn, usually either they can tear or she can have to have an episiotomy. And with the tear and episiotomy, it's usually somewhere right here between the vagina and the rectum in this area of the muscles here. It just depends. The problem with that is that you usually get scar tissue, and scar tissue does not stretch like regular tissue does. So after it heals, it's going to be harder to stretch that area out, and it may be more painful. Okay, in addition to that, you can get, because these muscles are even weakened from all the stress of labor and all, you can get more problems with urinary incontinence and fecal incontinence and prolapse, organs coming down further than they should. And those muscles that are so stretched out, they can actually spasm because they're trying very hard to do their job. They're trying very hard not to allow urine to leak out, but they actually can spasm because they're at such a longer length and they're weakened, and all of that work they're doing can make them spasm, which can give you pelvic pain or low back pain in any of this area here. So what can you do? First off, you can, if your partner is having these kind of problems, she may be too embarrassed to tell you, but if she talks to you about it, you may encourage her to see her doctor or a pelvic health physical therapist who can help her with some of these issues. We also have a little device here called the Caheel. This Caheel actually inserts in the vagina, and it can measure how strong those muscles are. It connects to an app on your cell phone, and it has little games you can play to help strengthen those muscles. It has a massage mode, which can help with the pain and tenderness, and some of the scar tissue that's in there. You can use the massaging, will feel very good. And this little device is available through our Joy On website or through Amazon. You can get it through Amazon and read more about it on our Joy On website. So, first off, congratulations. The baby you get out of this is more than worth it. Secondly, as I said, not all women will have these problems, okay? Some will. And they may be hesitant to have relations with you or sexual intercourse with you after having these kind of problems because of what's going on down here. So showing a little bit of understanding will go a long ways, and you can learn, if you want to, you can learn how to help her through some of this by participating in her pelvic health visits if she does see a physical therapist. So, congratulations, and Happy kegling.